Hi, I'm State Representative Andy Billig from the 3rd Legislative District in Spokane. I want to welcome you to another edition of our Washington and Whiteboard. Today I want to talk to you about healthcare and how it relates to the operating budget that we're working on right now here in Olympia. On the whiteboard, we've got 10 people. This is supposed to be a cross-section of the people that live here in our great state of Washington. So we've got a couple of people that work for a small business, a couple of people that work for a big business, a teacher, a state employee, a college student, and a few other people from Washington. And they or their employers each pay $500 to a health insurance company for their health insurance premium. And then that money, at least most of that money, eventually gets to our healthcare system, and this is our great rendition of a hospital and our other healthcare system representing doctors and clinics. So this system, when everybody's paying, it's okay. $500 a month is still a lot of money, but we're in some harmony here with our money going over and paying for health insurance. But then what's happening in our current system is people are losing their health insurance for a variety of reasons. So what we're going to do is we're going to say these top 2 people lost their health insurance. One of them, let's say, lost their job, and the other person was on the state's basic health plan and the eligibility requirements were reduced, so they lost their health insurance there. Just because they lost their health insurance doesn't mean that they don't get sick. In fact, they may get sicker because people that don't have health insurance are less likely to get preventative care or more likely to enter the healthcare system at a later point in their illness. Also, people that don't have health insurance are more likely to end up getting treatment in the emergency rooms, which is the most expensive place in our healthcare system to get treatment. So instead of our 10 people who were all paying $5,000 into our healthcare system, now we have our total cost is actually going to go up because we're getting more expensive care. So now our total cost is going to be, let's say for the sake of round numbers, is going to be $6,400. And instead of having 10 people paying into that amount of money, for 8 people to pay the $6,400, now it's going to be $800, okay, times 8 to equal the $6,400. Now, what happens when the health insurance rates go from $500 to $800? Now what happens is we had 2 more people fall off of our health insurance because the large employer or the small employer says, gosh, we love our employees, but we can't afford $800 a month. Or maybe that college student who was had their parents paying for it said, we can't afford the $800 a month. So as the rates go up, we lose 2 more people off of health insurance. Again, those people are still getting sick. Now they're getting the most expensive health care. So let's say now our total bill for these 10 people is going to now be $7,200 a month. So now the cost, because we only have 6 people paying for that $7,200, now the cost per person is $1,200 a month times our 6 people. Well, that means more people fall off of health insurance because they can't afford to pay or their employer can't afford to pay. So that's our current spiral that we're in. We're in this downward spiral where more people are falling off health insurance, and that means the people that have health insurance are continuing to pay more because the costs not only do they continue because people continue to get sick, but the costs actually go up because of the type of treatment that they get. So what's our solution? Because obviously the current spiral is not going to work. Well, there's 2 ways. There's actually a bunch of ways that we can help the system, but 2 that I want to focus on. One is to go back to our original starting place where everybody has health insurance. Because if everybody has health insurance, that helps stabilize the costs for the entire system. And that's why the national healthcare reform is so important, and in 2014 is going to be implemented where everybody will have health insurance. That is going to be a huge step forward in stabilizing the system. In the meantime, what we've got to make sure is that our state investments in health insurance, things like the Apple Health for Kids and the Basic Health Plan, are continued at significant levels so that we keep people on health insurance until 2014 when the national health care reform takes greater effect. The second thing that we can do is to reduce these numbers, to keep people healthy. Sometimes we forget and we think that the goal of our healthcare system is to have good healthcare. The goal is not to have good healthcare. The goal is to have good health. And to the extent that we can keep people healthy and keep people from entering this part of the equation, we are going to be much better as a community, much healthier as a community, and we're going to save money. So another thing that we can focus on in our state budget that's going to help in our overall healthcare equation is to focus on preventative programs and focus on systems that foster healthy living, like good transportation systems, like transit, which increases walking, bike, and pedestrian programs in transportation, programs that help educate kids about healthy food options and to make sure that in our schools we have healthy food options, and all of the preventative health and public health investments that we make in the state are very important. So those are some of the things related to healthcare that I've been thinking about and will be thinking about over the next couple of weeks as we finalize our budget here in Olympia. Thanks so much for joining me for this edition of the Washington Whiteboard. I'm Andy Billig.